I'm Jim Longworth, and welcome to another edition of Forsyth County Connections, coming to you from the Government Center here in downtown Winston-Salem. So glad you could join us. We have a lot in store for you in this particular half hour, and I hope you'll stay with us the whole time. But where we want to start, which I guess is not a surprising place to start, is to talk about COVID and get updates about COVID and where we stand with various things. To help us do that, the man who can give us all the information, Joshua Swift, is a Public Health Director for Forsyth County. Welcome to the program.
Thank you for having me.
Bring us up to speed on how many new cases of COVID we seem to be seeing each week or each month, or give me some idea of how it is.
Well, right now we're currently in a surge related to the Omicron variant. The week after Christmas, the 26th through the 1st of the year, we're reporting 3,600 cases.
And we're taping this, just as a disclaimer, we're taping this on Wednesday, January 5th. So your data is coming, it's pretty recent.
Yeah, that's the most recent data. We just got that report this morning from the state.
There are, discussions and debates now about the at-home testing or the rapid testing, however you want to call it. Are those becoming readily available?
Well, obviously it depends on when you're watching this. Right now, what we're seeing is there is a high demand. So it can be challenging to get a test, whether it's at home, at a doctor's office, at a testing center. So we're encouraging people, to get whichever test they can. Ideally, if you're symptomatic or you've been a close contact to a confirmed positive. We've seen in the past where some people will just get tested routinely as a precaution. And at this day and time, we're not recommending that. And also, don't go to the emergency room for a test.
Absolutely. Now, let me throw out a term. Fully vaccinated is the term. Fully vaccinated. That is talking about a term that's debated, and what does it really mean? I've had people come out and say, what does it really mean to be fully vaccinated? You give us your opinion.
Well, I'll give you what the CDC says currently. Currently, it says that fully vaccinated means you've had 2 doses of Moderna, or 2 doses of Pfizer, or the 1 dose of Johnson & Johnson.
Okay.
I do anticipate that pretty soon that will be changed from the CDC, and then they will include the booster.
Yeah, I was wondering about that, because that brings me to my next question. There are folks, I don't guess it's too personal, but my wife and I got the Johnson & Johnson shot, okay? Now, we got the booster after doing some research. We got the Moderna booster, because they said it's a pretty good booster. But is that okay to do? In other words, if you have one brand of the initial vaccination, to mix and match with the boosters?
Yeah, that is perfectly fine. And some science is showing that actually you can do better by having separate types of vaccine.
But you mentioned Omicron, the new variant. Gosh, it's got a lot of people worried, because there's this debate about, well, are any of the vaccines or any of the boosters really going to help against that? Or what's your feeling?
Well, I think the biggest thing to keep in mind is the vaccines, obviously they're very good about preventing the virus from occurring, but they're not 100% foolproof. You still could get COVID. I'm a case in point. I had 2 doses of Moderna and a booster, and I still got COVID, but it was very mild. It wasn't severe. It was just like a cold.
So if I know there are people who are anti-vaxxers, and we won't get into the politics of that, but quite frankly, you're a healthy guy, but if you hadn't been vaccinated, you could have ended up in the hospital, right?
Yeah, what we're seeing now in early January is that, 99% of people in ICU with severe illness are unvaccinated.
Unvaccinated.
Yeah.
What's your, let me just pick at you a little bit with this about masks, because I keep talking about various things that are debated and hotly debated in politics. Mask mandates and things like that. What do you feel is appropriate, even if you've had the vaccinations? Should you wear a mask when you go to the store or when you're with other people?
Well, yes, definitely. You should wear a mask. It protects you somewhat, but it also protects others. You could be fully vaccinated, you could have the booster, and you could have COVID and not know it, and you could share it, unfortunately, with someone else. So yes, the mask do work. We still have a mask mandate in the city of Winston-Salem. Some municipalities across the state do, some don't. But I would encourage people, especially for this next month or so, to continue to wear your mask indoors.
Yeah, with this new variant going wild and everything. Absolutely. Very quickly, you had mentioned to me off camera a website or something that people can get more information.
Yeah, you can go to forsyth.cc/COVID update. That is our local website, and we are pulling that directly from the state's dashboard, the NCDHHS COVID dashboard.
Joshua, I know you have a lot to do. Thanks for spending a few minutes with us here on the show, and thanks for all the service you're doing for the county.
All right, thank you, and appreciate all the public health staff. Been working hard for 20 months.
Absolutely. I know y'all are worn down with a frazzle, but we appreciate what you're doing.
Thank you.
We'll be right back after this.
Here you go.
Thank you.
Thank you.
Right now on Forsyth County Connections, thanks for staying with us. We have a very special guest I'm going to talk with right now. She's Hamlin. She's Program Supervisor for Stepping Up, Forsyth County Department of Public Health. Welcome to the show.
Thank you. Thank you for having me today.
This is, and pardon my ignorance, but I had never heard of what Stepping Up is about. So here you are. This is a perfect opportunity for me to learn about it. What is the Stepping Up initiative, and why was it needed?
Well, the Stepping Up initiative is actually a national initiative with the National Association of Counties, the American Psychiatric Association Foundation, and the Council of State Government Justice Center. And in April of 2015, Commissioner Wisenhunt, who attends a lot of the NACO, or National Association of County conferences, discovered this National Stepping Up initiative, where they're asking the counties across the United States to sign a resolution saying they will work to reduce the number of people with mental illness in their local jails.
Right, because it's a tragic cycle without getting help, and a lot of recidivism in that. So when Gloria Wisenhunt and you, I guess, sort of put your heads together on this thing, you determined that it was a significant problem here in the county, though, right?
Right. So after the resolution was signed, a small group of us actually worked for the local management entity at the time, which is now Partners Behavioral Health.
Right.
And the county, we worked together to do some research about what would be a good process for the county and what would be a good population.
You mentioned in an email there was an acronym, if I'm recalling, and it was SUPER, SUPER.
SUPER.
What is the SUPER program?
So that's the process we came out with. So that's the Stepping Up process to end recidivism. We decided that we would work first with the female population at the Forsyth County Detention Center. So that's what that acronym stands for.
Now, how does somebody get referred into this system?
So for the SUPER program, we take referrals. It can come from the jail. So it could be the resident himself. It could be the staff. Here recently, we've opened up to even community referrals. So just give us a name. A lot of people just call me directly, give me a name.
Could be a doctor or a social services person. So you're open to any kind of
referral. If it's somebody who's experiencing a mental health, substance use issue, and has some type of criminal justice involvement.
Now, you have something I also noticed you were telling me about earlier, the mental health court. Mental health court.
Right.
Now, what is that all about?
So mental health court has actually been in the county for a while. It's been here since 2012. And at that time, I was a part of the group that put that together. It's a specialized court. It's actually pre-plea for people with severe and persistent mental illness. So people who have like diagnoses of schizophrenia, bipolar, major depressive disorder, schizoaffective. And so if they get a charge, their charge can actually be handled in that court. They are court-ordered or mandated to do treatment for their mental health issue. And then if they complete their treatment and complete the course successfully, their charges are actually dismissed.
Right. Now, is it the referral process for the mental health court similar to what you talked to me about a few minutes ago?
Actually, it's not. So since mental health court is a legal decision, if a person has an attorney, the attorney actually has a form that they have to complete. And in some instances, it has to be signed by the district attorney for a court first, and then it is given to our case manager for that program to do the actual screening.
I'm thinking, I wanted to ask you, and we didn't rehearse this or anything, but how you feel things are going. I know it's putting you on the spot, but you don't have to give me data necessarily, but I mean, do you have a sense of how it's working or how it's helping people or how you feel about it?
I feel like for those who are motivated to make that change in their life, it's going really well. So far, we've had 19 graduates of the program. 17 of those are females and 2 are males. We just started the male program for Super in 2020. Mental health court, we've had numerous graduates, and from the data that I do know offhand, for the past several months, they've had a 0% of recidivism. So I feel like it's going really well. And
congratulations.
Thank you.
You're doing remarkable work.
Mm-hmm.
Now, I think there's a website, steppingupforsyth.cc. Is that right?
Yes, sir.
Steppingupforsyth.cc. So people can learn more information about that. Amber, thanks for all you're doing.
All right. Thank you.
All right. We'll be right back after this.
Unlike other health concerns, mental illness is not always easy to see.
DEPR.
Mental illness doesn't show up on a scale.
Bipolar?
Sorting out a mental health concern takes professional diagnosis and treatment.
Anxiety. I thought so.
If you or a loved one has a mental health concern, don't go it alone. For 24-hour free and confidential information and treatment referral, call 1-800-662-HELP. Learn more at samhsa.gov/support.
Back now on Forsyth County Connections, let's talk about taxes. Wait a minute, don't change the channel. I'm not going to raise your taxes right here in the middle of this segment, but we do have a man who understands all about it, and specifically about this quarter-cent sales tax that we've heard a lot about over the past year or so. With me right now is Kyle Wolf. He's Budget and Management Director for Forsyth County. Welcome to the show.
Thanks for having me.
What exactly is the quarter-cent sales tax that we've heard about so much?
Sure. So, as you know, when we purchase anything, from a store, any kind of good or service, you're typically going to pay some kind of sales tax on those goods and services. And so, in North Carolina, it will vary from county to county. And for the longest time, our tax rate or sales tax rate in Forsyth County was 6.75%.
Right.
4.75 of that goes to the state, and then 4.75 was with the state, and then 2% was with the county. And so a couple of years ago, we had a referendum placed on the ballot to increase the sales tax by 1/4 cent. And voters approved it a couple of years ago, and so now our sales tax rate is 7%.
Now, why was that so important that we raise that? Because I know people, anytime you say we're going to raise a new tax, but it actually had some benefits to it that sort of outweighed it. So help me with that.
So, so a couple of years ago, the school system had come to the county and asked for a fairly significant increase in their budget. And I mean, and a big part of it was raising money for teacher supplements.
Right.
And so the quarter-cent sales tax really, it would have, if the increase for the school system, it would have really probably cost about 3 cents on a property tax rate.
Right.
Meaning the board would have had to increase property taxes by 3 cents to actually fund that. By doing this quarter-cent sales tax, we really were able to do that and increase the appropriation of the school system without.
Yeah, and the teachers really needed more money, but they couldn't just go out and lobby and this had to be done through your office and trying to get help through that. Did the Board of Commissioners, have they already sort of committed to using the dollars for certain things? Is that etched in stone, and how's that going?
So when the resolution passed to actually put the referendum on the ballot, they absolutely did say we want to earmark this for the school system for teacher supplements. It's not something that they can bind future boards to, but they have committed to doing that. And over this, especially if you could see it this past year when that quarter-cent sales tax generated more money than we had budgeted. And so really a couple months ago, we actually gave the school system the additional money that came in.
Yeah, I think that's great. But let me put you on the spot. I mean, how flexible can this be in terms of where they allocate? In other words, if you came to them to a commissioner's meeting and said, hey, we've got a problem with such and such, can they say, well, we were going to spend some of that money on this, but okay, Kyle, we'll spend it on that? I mean, can they change their mind on how the allocations are going, or how does that work?
I mean, in theory, they actually could, but they have really shown a commitment that they're not going to do that.
All right. Now, how much revenue is projected to be generated, let's say, this year? We're now into 2022.
Correct.
I guess it's hard to project anything given all the pandemic and everything else that's going on, the economy, people not going back to work by choice and all that. But what do you think? Because with this quarter-cent thing that's driven, as you said, by the sales, people buying things, Can you make any kind of projection as to what kind of money we're talking about?
It's a tricky game every year when we are doing the budget to try and estimate our sales tax. So, for example, when the pandemic hit, we thought sales taxes were going to just really plummet, and so we only budgeted, I think, $11 million for that Article 46 sales tax, the quarter-cent sales tax. And again, they came in at $17 million. So again, the board appropriated that money there. It looks like we're probably going to be around $17.5 million this current year.
What does all this mean for teacher supplements?
And so it's really the school system that does that. But looking at the supplement schedule that they have posted online, it looks like the supplement is increasing on average by about $3,850. As a result of
That'd be
this.
great. That'd be great. Of course, you never know. I mean, there's nothing you don't have a crystal ball that I know of in your office.
I wish I did.
Yeah, if you did. But you can help us with that anyway. But I appreciate all the work you're doing and keeping track of all this. It's very important work. And thanks for spending a few minutes with us.
Absolutely, anytime.
All right. We'll be right back after this.
Performing on stage takes mental and physical preparation. But one thing I never thought to prepare for was cervical cancer. 91% of cervical cancers are caused by the human papillomavirus, or HPV. The good news is there are vaccines that can protect you or your children from cancer. I survived my cancer, but you can stop cancer before it starts. Talk to your doctor and go to thinkaboutthelink.org to learn more.
Back now on Forsyth County Connections, and we have a very lovely guest with us right now. And she is Dewanna Hamlin, Director of the Family Justice Center for Forsyth County. Welcome to the show.
Thank you, Jim.
What is the Family Justice Center and why was it created? Because I hadn't heard anything about it. Tell me about it.
I'm so glad you asked. The Family Justice Center is a public-private partnership here in Forsyth County, but also functions as a department of Forsyth County government. We offer services in one location at no charge for individuals and families who have been impacted by interpersonal violence, such as domestic violence, sexual assault, child maltreatment, elder abuse, and human trafficking.
So sort of a one-stop center to be able to help folks that have been in that situation.
Absolutely.
What this might be a difficult thing. Let me see how I ask it. What is your philosophy, or what is the philosophy behind the way the center operates in your mission?
Well, it comes from a two-pronged approach. One is that it benefits clients so that they don't have to go to multiple locations across the community.
Right.
And Forsyth County is a pretty large community. And it also benefits our partners so that they can work together more seamlessly, effectively, and efficiently on behalf of clients, especially when we are looking at systems barriers and silos that sometimes do exist. We can work around those better when we're in the same location.
Now, we didn't rehearse this or anything, but give me an example. I mean, not name names or anything, but just a quick example of how somebody would be helped. Let's say that a woman is a victim of domestic violence. How do you exactly help her?
Well, the great thing about the Family Justice Center, not only do we have co-located services, but we have a client navigator that helps them from start to finish. So the client may be referred to us, they may call, they may walk in, and we do a brief questionnaire with them to assess why they're in the center. We consent them, take them back, and talk to them about the menu of options available to them, the partners that are on site and off site that we can provide access to.
And when you said, I'm going to interrupt you here, but when you said options, would that be anything from counseling to litigation?
Absolutely. We have counseling available for children and adults. People can also come there to file for a 50B, what we call an ex parte emergency domestic violence protective order.
What is that? How would that work?
They can they fill out the complaint, the form. They're sworn by the clerk's office. And the great thing, Jim, is all this happens virtually. And so they can have a hearing with the judge, just that person and the judge. They tell their side of the story about what happens, and then the judge decides whether to grant or deny that order.
And there's already stress in the home or the situation anyway, so this way it doesn't exacerbate it because it's done virtually and ex parte, and at least there's not as much stress, there's no fear of anything. They just work through the system in a fair way, right?
Yes, yes.
You've mentioned a couple times so far, and we've only been talking for a few minutes, you mentioned the word partners.
Yes.
Now, I want you to elaborate on that a little bit. What do you mean by partners?
Partners are organizations in the community that have a stake in making sure that our community is safe. Some of the more obvious partners might be like our law enforcement agencies. We have 3 law enforcement agencies that we work with the Family Justice Center. And of course, the district attorney's office, the magistrate's office, clerk's office. But there are also folks who provide advocacy. There are also organizations that provide financial literacy training and help with credit repair, because one of the most important reasons that people stay in situations is because of their finances, fear and finances.
Fear and finances. So
Fear
they
and finances.
may be in a very toxic situation, but feel like there's no way out.
Absolutely. But what we do is offer safety, hope, healing, and strength, which is part of our mission at the center.
You know, I was going to ask you about that because on the email you sent, it said Bridges of Hope Family Justice Center.
Yes.
Appropriate name.
Yes, Bridges to Hope. That was actually part of, during the planning process, we had survivors at the table, and they are a part of the planning, and that came, a lot of that from them. Our logo design, even the colors we used, were suggested by our survivors in the community.
Before time runs out, and there's no fee for this?
There's absolutely no fee for services at Bridges to Hope.
And what about hours of operation, location, phone number, website? I mean, is there anything you want to plug?
Absolutely. We are located at 725 North Highland Avenue in Annex 1. We're open Monday through Friday, and our service hours are 8:30 to 4:30 p.m. And that we can be reached by phone at 336-776-3255.
Well, write this down. I'm a slow writer. Say the phone number again.
336-776
Okay.
3255.
Well, that's just great. I really appreciate what you're doing for the community.
Thank you so much. We appreciate the community being involved and seeing this as important.
Well, come back sometime and give us an update, will you?
Absolutely. I'd love to.
All right. We'll be right back after this.
This is what too much sounds like. This is what stress feels like. And this is what help feels like. If you've lost a job, worry about your next meal, or have trouble making it through the day, we can help. Text STRESS to 211-211 to find a solution.
Unlike other health concerns, mental illness is not always easy to see.
DEP.
Sorting out a mental health concern takes professional diagnosis and treatment.
Anxiety.
If you or a loved one has a mental health concern, call 1-800-662-HELP for free and confidential information and treatment referral, or go to samhsa.gov/support.
Back now on Forsyth County Connections, let's talk about parks and recreation, shall we? And a very special guest, a familiar face to folks who have been around in the area for a while. Mike Anderson's with me. He's Director of Parks and Recreation for the county. Welcome to the show.
Thank you, Jim. Appreciate you having me.
You sent me an email and said to ask you about Horizons Park. What is Horizons Park?
Well, I'm glad you asked. I'm glad we talked about it. Horizons Park is our second largest park in the Forsyth County Park System. It's 492 acres. It's located on Memorial Industrial School Road in the Rural Hall, Germantown part of the county.
Okay.
It's really a beautiful piece of property with general rolling hills and hardwoods, and it's just a really gorgeous place.
A lot of people don't know about it.
No, it's in a real rural, still a rural section of the county, and a lot of people don't know about it, and that's why we're here today to talk a little bit about it.
Now, I think you told me one day has kind of a unique history to that property and to the park. What did you mean by that?
Sure does. Horizons Park, the land that the park sits on now, was actually an African-American children's orphanage back before the 70s. In the mid-70s, Forsyth County bought the park from Horizons Residential Care, who ran the children's orphanage at that time, and it became a park and opened to the public in the late 70s. It was actually a working children's farm, and there's still some buildings there today from the orphanage that are part of that. In addition to that, we also have a schoolhouse. It's a 2-room schoolhouse that's located in the park. It used to be down the road from us on Red Bank Road. It was a 2-room schoolhouse that operated in the 1880s up to the 1920s.
That's still there.
And it's still there. It's been redone. A community group took it and moved it from where it was falling apart, and put it in the park and have rebuilt it, and it looks just like an operating schoolhouse.
I think that's just great. Now, what are if somebody wants to go to the park, what are some of the features? What are some things going on?
Horizons has really got some nice features. It's got a picnic shelter. It's got hiking trails.
trails. You can walk on the hiking trails there, and it makes you feel like you're in the mountains. It's really pretty. It's got a ball field, volleyball courts, horseshoe pits. It's got a dog park, which is the first one we had in our county park system, where you can bring your dog into a fenced area and it'd be off leash.
All right.
And we also have one of the unique things we have is a disc golf course there too.
A disc golf. Now I see something sitting on the table. Hey, what is this here?
Sure do. If you remember when you were a kid, we used to call them frisbees.
Yeah.
Now Horizons Park has what's called a disc golf course. Now it's played very similar to golf, and what's disc golf players will call regular golf ball golf, just so they can distinguish between the two. But it's you take this disc and you start at a tee and you try to throw it into a basket, and how many strokes it takes to get there. That's how it's played. And there's different discs for different things. There's one you use to putt, and there's one that's used to throw off the tee. It's very popular. And then one of the unique things also about Horizons, the disc golf course there was the first disc golf course in the state of North Carolina.
How about that?
It's a great beginner's course, still in immaculate condition, and it's a really good place to learn the sport if you're interested in playing.
I think that's neat. Anything coming up at the park? Anything you're planning for?
Yeah, we've got two unique things happening for us. We partnered with a group called the Memorial Industrial Development Community Corporation, and they've started a community garden at Horizons Park, and they'll be doing educational programs and things like that. It actually started by one of the residents who used to be at the original Horizons Residential Care, Dr. English Bradshaw, and he started that. And we also have some money that was from the 2016 bond referendum that we're going to be doing some improvements and some additions out there. We're going to be adding trails, some horse trails. We're going to be renovating the old residential administration building out there and turning it into an indoor rental facility.
Let me back you up a second. You said horse trails. Does that mean people will be able to trailer their horses over there?
We're hoping they'll be able to trailer the horses in and ride on horse trails at the park. And we have some horse trails at Tanglewood, but we don't have anything on this side of the county, so we think it'll be kind of unique. We're also going to add a few other amenities to the park, possibly some other picnic shelters, things like that. But that's all coming in the future, and we're really excited about it.
So you don't have a specific date when the horse trails and things?
No, we sure don't. We're in the early stages of planning, and we hopefully in the next couple of years it'll be operational. So,
is there a number or website people should get in touch with if they want to find out more information about Horizons or about all the parks?
Yeah, they can log into the county's website, which I think we can put a link here on maybe on the end of this presentation to that. We can look at the county's website and just click on parks, and all our parks are located there, and there's actually pictures that you can see of different things that are available there. And like I said, our county is really proud of our park system. We have some really unique parks. All of them are different, have something different to offer to the public, so we encourage them to come out and use it.
Well, Mike, I appreciate it. There's so much going on, and they are fine facilities. And I might just take this disc, and we'll just play some disc golf sometime.
Sure do.
Since Mike mentioned websites and various things like that, you've seen on the show behind us throughout the program, connectwith.forsythcountync.gov. So that's the general website you can check out. Well, for Mike and all the guests today, I'm Jim Longworth. Thanks for joining us for this edition of Forsyth County Connections. We'll see you next time.